Despite medical advancements, cancer remains one of the most daunting diagnoses one can face. The challenge lies in the fact that cancer isn't a single illness, but rather a group of over 100 different diseases, each affecting various types of cells. Among these, leukemia is particularly troubling, as it is the most common cancer affecting children. This type of cancer begins in the bone marrow, where blood stem cells reside. Think of stem cells as the body's building blocks, like infants with immense potential. In many tissues, stem cells mature into specific types of cells, such as those in the liver, brain, or heart. Some stem cells, however, remain in a more primitive state, continually producing new cells as needed throughout a person's life. For instance, bone marrow stem cells generate various blood cells. These include red blood cells, which carry oxygen throughout the body, platelets, which help stop bleeding, and white blood cells, which defend against infections. Occasionally, errors occur during the process of cell specialization, leading to mutations in the DNA of these stem cells. While normally damaged cells self-destruct, some evade this process, multiplying uncontrollably and becoming cancerous. The reason leukemia is the most common cancer in children is not entirely understood. However, one theory is that leukemia often results from just a few DNA changes, whereas most cancers require multiple genetic alterations. This makes leukemia quicker to develop. Additionally, some DNA changes can happen in white blood cells even before birth, increasing the risk of leukemia in young children. Nonetheless, adults make up the majority of leukemia cases overall. Once leukemia takes hold, the cancerous cells proliferate in the blood and bone marrow, crowding out healthy cells. This depletion of healthy cells leads to several problems. Red blood cells are insufficient, causing fatigue and weakness. Platelets are low, which impairs wound healing, and the immune system suffers due to a lack of functional white blood cells, increasing the risk of infections. To combat leukemia, it's essential to eliminate the cancerous cells. Since leukemia doesn't form solid tumors that can be surgically removed, treatment relies on methods such as chemotherapy. Chemotherapy uses powerful drugs to kill rapidly dividing cells, including cancer cells. Unfortunately, this treatment also destroys healthy cells, such as those in hair follicles and the digestive tract. In some cases, the treatment might be so intense that it destroys all cells in the bone marrow, including the vital stem cells. When this happens, the body can no longer produce blood cells on its own. Thankfully, a bone marrow transplant can help. This involves transplanting stem cells from a donor's bone marrow into the patient. These new stem cells quickly populate the bone marrow and blood. However, finding a suitable donor is complex, as the transplanted cells must match the recipient's tissue type to avoid rejection. With thousands of HLA types, even close relatives may not always be a match, necessitating a broader search in donor databases. The larger the pool of potential donors, the higher the chances of finding a compatible match and saving lives. While leukemia is a fearsome illness, advancements in treatment and the extensive network of potential bone marrow donors offer hope and a path to recovery.